Welcome to the user group number 6. We're going to talk about improving clinician satisfaction. Here's what we're going to talk about: the impact of burnout. We'll talk about where it comes from. We'll talk about the research on provider satisfaction and the benefits. And we'll talk about what clinics are doing with secure mail that directly impacts provider satisfaction. And Mark's going to take us through a demo of some of the simple ways that you can use secure mail to do that. So just some of the functionality. That's pretty basic stuff, really, but really impactful on how it makes a difference. In terms of the impact of burnout, provider burnout is associated with adverse effects on physicians, patients, staff, and healthcare organizations. It's linked to diminished quality and safety and a compromised patient experience. What research has seen is that physicians who are reporting errors were 50% more likely to have symptoms of burnout. And it's 20% of the reason why physicians plan to cut down on clinical work or leave medicine. It can lead to further shortages, obviously. It's also, burnout leads to increased risk of depression and suicidal ideation. So we want to stay away from that stuff. Let's just take a quick look at where it comes from. So, in the middle, we've got, meaning in work. Am I doing things that's impactful to me? Am I practicing what I wanted to practice when I got started? Do I have control and flexibility? Is the organization, one where I share values? Is there support? Am I in this alone, or do I have help? And what sort of efficiency is happening here, and what resources do I have available? So when that stuff's good, we lead to engagement, vigor, dedication, absorption, focus on work, happiness, yay. And then when it's not, things get bad. So that's when we get into the burnout realm. So these are the things we want to try and address and make good. So what the research says is that physicians, when they're satisfied, when we've actually been able to improve satisfaction in physicians and clinicians, we see burnout scores go down by 300%, 3 times, and actually their intention to leave practice goes down 8 times as well. Successful healthcare leaders. So when we're looking to, there is a model, the Stanford model is kind of seen as the gold standard in addressing physician satisfaction. It looks at 3 different issues, and this has all been sort of clinically reviewed. The culture of well-being. So, hey, are we looking after ourselves? Are we taking care of ourselves? Or is it just like, let's work? Workplace efficiency. Are we doing things in a way that makes sense, that's easy and flows and doesn't take too much extra time? Or are we creating extra work and burden on ourselves? And then personal resilience. So, hey, let's all take some time to stretch or walk or listen to music. Sleep is a huge one, obviously. So that work-life balance stuff comes back into it. And, we didn't set out as Brightsquid to improve physician work-life balance, but it turns out we have, with the help of some people who have figured it out at the clinic level. We're going to talk about workplace efficiency, clinical administrative workload. We're going to talk about, supports for clinicians, how we can help, staff be more supportive. We talked about that in April in user group number 5. The recording is up if you haven't watched it. It's under the community tips tab on brightsquid.com. So that's a really good resource to check out, because having satisfied staff that are doing more productive work in the clinic actually also improves physician satisfaction. So it's kind of a 2-for-1 deal there. And what researchers have found is that organization-based interventions, so things that you do at the organization or clinic level to improve satisfaction, are more impactful than working one-on-one with doctors. Hey, what would you like to see? Implementing things across the clinic has a bigger impact. And it's been found that technologies that improve operations, staff engagement, clinical effectiveness, and patient outcomes boost provider satisfaction as well. So some of those technology advances can be important. Satisfaction from the working environment. So when you look at that research, we find out that, hey, it's really kind of all about how the setup is in the clinic. We found that satisfaction is associated with less chaos, more cohesion, and better communication. Not a big surprise there. People don't like to work in a frantic environment. Physicians are more satisfied when they see themselves or their practice or their healthcare organization as providing high quality care to patients. Obviously dissatisfied when they perceive barriers to delivering high quality care. So there's a number of things that we sometimes put in place without realizing it that are holding back the clinic or the physicians or the clinicians from providing that high quality care. And we'll talk about some of the things that we address through secure mail that clinics are doing to take down some of those unseen barriers and some of the known barriers as well, obviously. Working with adequate numbers of well-trained, trusted, and capable allied health providers and support staff. Building that community, that circle of care, the team-based care. We know for decades we've been talking about team-based care is the answer. It's the right approach. Nobody's going to go in and solve healthcare or patient issues on their own. We need to work together on our specialties and expertise to contribute to greater well-being as a whole. That makes a ton of sense. There's an article nationally in Canada a couple of weeks ago, maybe a month ago now, an opinion piece by a physician in Montreal who said, I'm giving up. I'm quitting my practice. And part of the reason was there wasn't adequate resources to refer patients out to who needed extra support. And he was just lost. He drowned trying to deal with that himself, and he needed to offload that work, and he didn't have the community or the network to offload that to. Greater staff stability. So again, we talked about that in April in user group number 5. Lower turnover, having dependable staff, knowing that the staff that are trained and you work with and you work well together are going to be there next week and the next month and next year, that takes a lot of stress off, right? Am I going to have to turn around and figure that out? What's the cost of replacing somebody from a training standpoint? How much time are we going to lose? How many patients are we going to not be able to handle properly? What are we going to fumble along the way as we're trying to get someone else up to speed? We want to have that stability. So staff satisfaction and continuity there actually, again, supports physician satisfaction. So these two go hand in hand. We'll talk about now what SecureMail is doing for improved satisfaction. We looked at it from a staff perspective. Okay, we talked about removing repetitive jobs, low-value tasks, that kind of thing. And so when we look at the research in the slides above, there's a couple of themes, right? Clinic effectiveness, efficiency comes out, right? We want to do good work. We want to have high quality care. We actually want to be impactful in our job. So part of that is reallocating staff time to more productive and rewarding tasks, because now they can handle more of the administrative burden that's kind of put up onto physicians. So we move staff up from handling, stuffing mail envelopes and all that kind of stuff, and have them do more of the patient prep stuff that get patient ready for a really impactful appointment. And also, putting some of that work onto patients. So engage patients as prepared participants in their care. We'll talk about that in the next slide. Remove barriers to quality. So focus clinician time on the most meaningful use of their expertise. Where do they really need to be spending their time today? Which patients really need to be seen? Which patients can be addressed in a different way? Like through SecureMail, lots of clinics are doing that. And we'll show you how clinics have increased access by increasing their capacity without working extra hours, but just creating space in the day. And then collaboration. So we talked about, having that circle of care, the colleagues that you can depend on. And so we'll talk about how consultation with specialists work, and we'll talk about continuity or community of allied health providers for team-based care. When we're reallocating staff time, that does increase staff retention. If you were here for the staff satisfaction presentation 2 months ago, you saw that. Reduce mail, right? So we've had clinics who have done this study. What does it take to mail a package, to collect the files, write the letters, print them off, fold them, stick them in an envelope, put a stamp on and get it delivered, versus attaching all those files to a SecureMail message or a SecureMail template that's already typed and clicking send? It's a 75% time savings. So in one clinic, they said it took 15 to 20 minutes to do that manually with paper, and it took 2 to 3 minutes to do it through SecureMail. So you decide how you want to spend your staff's time. Eliminate dead-end phone calls. Calling patients. Mark tells this story all the time, talking to one clinic about reaching out to patients, and they say, well, in the 90s, everybody had one phone number and they answered it. Now we've got 4 or 5 and they don't answer any of them. We make phone calls anyway, and clinics call, and you can't leave a voicemail. Sending a SecureMail message is complete. It doesn't have to be, hey, call us back, we have some important information for you. It's more like, here's the information we need you to know. And the same goes for when patients call you, right? We have more and more dead-end phone calls at clinics as clinics look to figure out how to spend less time on the phone by shutting down phone lines and adding all the FAQ answers to their phone tree. We actually timed calling into one clinic that we work with, and the voicemail message at the beginning, before you even have the opportunity to talk to a real person, it was 3 minutes long, and that's causing frustration for patients. And we're actually working with clinics to offer SecureMail so that patients can have an alternative way to reach out, right? If it's lunchtime and I need to call my doctor's office, but they're not answering the phone, what else can I do? I have to go back to work at 1 o'clock, and that's when they come back to work, but I can't call then. But I can send a secure mail message, and then they can, we can figure something out. We've seen phone traffic get reduced by 30%. I think it's actually, there's clinics that have done it higher than that, but we've seen this number consistently because we're replacing phone calls with these messages. And some clinics that have reduced phone traffic like that have actually reduced the length of phone calls as well, because we can supplement with secure mail, and we're moving a lot of those high length calls, the lengthy phone calls, onto a secure mail message, which is much more efficient. Engaging patients prepared participants in their care, pre-appointment instructions. Hey, we'd like you to do this before you come in, so they're not calling, they show up prepared, the appointment runs smoothly. Or questions. Hey, fill out this questionnaire in advance. And like I said, we don't have to work around each other's schedules. We can send messages back and forth as convenient for each other. So what do people say about this? So Dr. Dickey said the amount of time savings is quite significant just by giving patients the ability to communicate this way. Another clinic manager here, it's much more efficient to attach a file to a message rather than put it off, print it off with an accompanying letter, fold it in an envelope, and get it in the mail. And that should be pretty clear. But I think when we survey clinics, there are about 100 or so mail message, 150 on average, that clinics could be replacing with secure mail messages. And so take a look at what you're sending in the mail and think if you really need to do it that way, or if it's much easier and cheaper and faster to do it by secure mail. Removing barriers, we can focus clinician time on the most meaningful use of their expertise. So collecting information in advance, we'll get a quote on this in a second. Asking some of the questions beforehand to get that information in the EMR, the staff copy and paste it and put it into the patient record. The physician's not typing that. We're cutting back on that 50%. About 50% of time physicians are spending entering data now is what they say. So we want to get that down. That improves satisfaction. So let staff collect that information from patients in advance securely through secure mail, put it in the EMR. The physician's got a sense of what's going on when they go in to meet with the patient, and appointment times get shorter. That's where some of the capacity gains come from. Appointments are shorter by as much as half. And by doing some patient concerns through secure mail, which many can be done that way, you said to figure out how it works in your clinic. We save face-to-face time for those people that might have had to wait till next Wednesday. They can get care much sooner, and we can have more meaningful use of a physician's day by addressing patients that really, really do need to be in there. And all through that increases access. The research shows we've seen clinics improve their capacity by as much as 50% doing that process. On average, research says implementing secure mail at your clinic gives you about a 10% uplift in capacity. Imagine a 10% uplift in primary care capacity across the system. So we cut back on phone tag, we reduce hold time, patients can get through because they're not waiting for someone else's phone conversation to end, and they're not giving up on pursuing care, right? It's like, I tried to get to see my doctor, but so maybe they get care somewhere else. So we see continuity and patient attachment go away, and we further fragment the healthcare system. We know that about 80% of patients are willing to switch providers for convenience alone, right? Patients just want care. They'd like to go to their doctor, but if they can't, if it's difficult, if it's frustrating, they'll just get it somewhere else. So what do the people say? We use secure mail to allow physicians to be able to work outside the normal office structure. So I'm not in the clinic, but I can still respond to messages. We asked patients to answer preliminary interview questions in advance of appointments, and I was able to get to the root of the issue much more quickly, and so appointments were just as effective in half the time. Quickly, we'll talk about collaboration. Consultation with specialists, sending secure mail, much easier than phone. The last time I was at the doctor, he was late because he said, sorry, I had to take a call back from a specialist. Well, what if that was a secure mail message and we didn't interrupt the flow of appointments and we kept things running on time? We have accelerated access to expertise by doing e-consults. Hey, cardiologist, here's the presentation of my patient. What do you think I should do next? Rather than just sending them off to wait for 8 to 10 to 12 months for that specialist consultation, see if there's something you can do in the meantime, or if the cardiologist can maybe refer them to someone else, say, hey, this isn't the right line for them, they should go over here instead. It cuts a whole lot of burden out of the healthcare system. We've worked with clinics and actually tracked a 94% reduction in wait times for a specialist opinion from spinal surgeons. And then, we talk about Brightsquid has a connected healthcare community. There are doctors, dentists, chiropractors, physios, psychologists, social workers, dietitians, nurses, you name it, all available in the community. And you'll see there's a directory in your account, and they're all in there. If you've got patients and they say, hey, I want to work, I've got this person, maybe we should connect and really unite that circle of care. You can also invite anybody to collaborate with you through SecureMail, and they get a free account. There's thousands in there, and you can always invite more if there's other professionals that you need to or want to work with that right now you're faxing for some reason or mailing for some reason. So yeah, here we go. From one chiropractor, without quickly connecting with the rest of the circle of care, I wouldn't be able to provide the full and complete services to my patients. Dr. Abelson does a lot of motor vehicle accident sort of treatment. And he works with a number of different providers, and he collaborates through SecureMail. It's threaded, and you can have conversations with multiple recipients, so everybody can contribute to the conversation at their convenience. You don't have to set up a conference call to get everybody engaged. Completing consultations via SecureMail provides peace of mind and confidence that actual medical direction is being provided correctly and in a timely manner. So Dr. Campbell is a specialist who provides e-consult advice back to primary care providers through SecureMail, through Brightsquid. So Mark, I know we're going to do a quick, simple sort of demonstration, and I'll let you take over. And we do have a couple of quick questions. While you're getting set up, though, I would like to do one more poll. Do you believe that improved use of SecureMail will improve clinician satisfaction in your clinic? So someone said no. We get some no's in there, and about 80% are saying yes. So Mark, here you go.
Excellent. Thanks very much, Jeff. You should be seeing my shared screen now of my SecureMail inbox. So I will say up front, if you have any questions about what Jeff has talked about in terms of using SecureMail more efficiently to make your clinic run even just a little bit smoother, 10% is a big thing. You can always contact our support department, or you can call me directly through the support line, and I'd be happy to do a little one-on-one ad hoc demo training session if that would be helpful for you. So where I am here on my shared inbox is just showing a message that I've gotten back from a patient. And just to really quickly run through the interaction that occurred here is the clinic sent a message to the patient with a couple of forms they wanted them to fill in, and we included our directions for parking and how to find the location. It seems really simple, but if you think about the number of times you get a phone call from a patient before their appointment where they're asking those questions. I forgot your address. How do I get there? Where do I park when I get there? How much does parking cost? Do I need to pay for the full hour? Remember that when that patient phoned you to ask that question, as Jeff mentioned, they probably had to wait through a 3-minute prelude on the phone call before they got through to you. Wouldn't it be nice if they had all this information at their fingertips, that is to say on their phone, so they didn't have to place that phone call? Those little bits of improved customer service, I know for me personally, are very, very valuable. Just the other day, I called my dentist, and before I heard a human voice, I had to listen through a 90-second message about their COVID protocols and what to do if I had this question and what to do if I had that question, which is all valid information, but I really would just like to talk to a person. And I found the waiting time, waiting through those messages, just to be frustrating for me. So anyway, just something to think about. Now, one of the things that I often will show users after they've been using SecureMail for a little while is how they can do their more advanced message routing. So incoming messages to Brightsquid SecureMail, as most of you know, will wind up either in your own personal private inbox that only you can see, or in the shared inbox. And the shared inbox ostensibly is configured in such a way that it is being monitored by staff whose job it is to deal with those incoming messages. So clinic staff, MOA, receptionists, what have you. Rarely, in some rare cases, it's the physicians, but that's relatively unusual. And the key way to configure the shared inbox is by way of settings. And then over here in clinic members, in my clinic, there's 3 people that work here. I'm logged in as Clara right now. I'm the MOA. And there's 2 doctors in my clinic, Dr. James and Dr. Pierre. And you'll notice that for Dr. James here in the middle, he does not have access to the shared inbox. So that is to say, when Dr. James logs in, he doesn't even see the shared inbox, nor is he made aware of any messages that get routed there. Furthermore, if we expand Dr. James's profile, Down here near the bottom is this, what I like to colloquially call the message deflection system. And by setting it up so that I no longer allow patients to message me, and by me I mean Dr. James, and by not allowing professionals to message me, what's actually happening is I'm deflecting messages from those types of individuals to my shared inbox. And guess who's dealing with those shared inbox messages? That would be Clara. So Dr. James can send messages through secure mail all the live long day, but whenever someone replies back to them, back to him, I should say, that message gets deflected to the shared inbox and Clara takes care of it. So Clara may put something in the EMR. She may go over and talk to Dr. James and say, I need your advice on this question from Mr. So-and-so. But the point of it is, Dr. James does not need to concern himself with the day-to-day activities of receiving incoming secure mail messages. To Jeff's point, he can continue in the flow of dealing with appointments with people in front of him, and when he has a moment, he can asynchronously attend to those messages. Now, let's talk about those messages and how we can save some time in sending those. Most of you may already be aware, but some might not, is when you're composing a message to a recipient, you of course are welcome to type the messages by hand every time you send a message. But think about how often you send the same message day in and day out. Dear Mr. So-and-so, thanks for coming in yesterday. Here's some information you might need. All of that stuff can be templated, and you can create for your clinic as many different templates as you feel you would need to minimize the amount of manual keystrokes you have to type in. So just like that, I've selected the new patient welcome message, and automatically Secure Mail is populated with the attachments that a new patient would need. So here's the history form we want you to fill in, here's directions and parking, and a little friendly welcome message about how we're going to use Secure Mail to interact with you. That in and of itself is going to save me, 2, 3, 4, 5 minutes every time that I need to send this kind of a message to a patient. Furthermore, I can create my own templates, and let me show you how this works. I'm going to go back to settings and then to the templates tab. And here's a list of all the templates that I already have. Anytime that I want to make a new one, it's as simple as composing a message. So I can just give the template a name. We'll just call it webinar test. Subject line is going to be hello. And as you can see, I've already copied and pasted in some text, and I'll attach some files. And in this case, I'm going to attach a PDF document, answers to frequently asked questions. And just like that, I have a new template in my box of tools, so that anytime I need to send this message to someone, I can pull it up in a heartbeat and get that sent off. Now I'm just looking at the clock on the wall, and as expected, Jeff has taken the lion's share of today's time. So I would love to show you more of this. If you have specific questions about the templates, how to use them, where to use them, how to create more, how to delete the old ones you don't need anymore, all that can be handled by me directly or through our support team, who you can reach at their website at support.brightsquid.com. And of course, just always call the toll-free number and press 1 to talk to support.
Thanks, Mark. If you can stick around for a couple minutes, I appreciate it. I think we have a couple questions. Mark, I'll kind of address them to you. And it kind of speaks to, I guess, your offer to help people set up their accounts. So how do you set up accounts for all staff?
Well, you can add staff through that settings option in Clinic Members that I was showing a moment ago. So by going into Clinic Members, you can invite additional staff members to your organization as needed, and when they no longer work there, you can easily remove them from the organization to ensure that they no longer have access to any patient information that they may have had access to while they were employed. So that's through settings and then Clinic Members, and then there's a whole invitation process there. It's very easy. All you need to do to invite someone is their email address, and we send them an invitation and we take care of the rest.
Yeah, and then you set up their role and any kind of allocations you want. Are they an administrator? Do they get shared access? That kind of stuff.
Exactly. As I showed with my Dr. James example there, as the clinic administrator, I can do all of that configuration on behalf of my end users. So if Dr. James decides not to use Secure Mail very much, then the administrator takes care of that on his behalf.
Can you set clinician accounts to only receive internal communications?
You can set your clinician accounts, for example, to only receive messages from other medical professionals, which would include internal coworkers and colleagues, but we can't block messages from all external professional colleagues. So if we allow it for internal doctors to send you stuff, you'd also be receiving messages from external doctors. So that is one limitation in the configuration that I showed earlier, where Dr. James has turned off all professional communications and all patient communications.
Right. And then one last question. What if other clinics won't accept secure mail? So they want to keep using fax or mail or something else?
Well, this is a question that comes up from time to time where, in fact, I had a phone call this morning from a client I think they were in Washington State, and they had that exact question is, I sent a secure mail message to this other colleague across town, and they called me back and asked if I could please send it to them through regular email because they found Brightsquid too hard to use. To my mind, that's a bit of a red flag. If someone is asking you to send healthcare information through a non-compliant, non-secure service like old-fashioned email, I have all kinds of questions about that. But also, secure mail is not complicated to use. Everyone on this call has been using it. We're seeing hundreds of thousands of messages flying around our network every single month. And we're here to help as much as possible. So if you do have a recipient who throws up barriers and doesn't want to use secure mail, I'd encourage you to get them in touch with our support team. We will help them walk through the process. It's very, very easy to get logged in. If it's their first time logging in, we ask them for their name and their address and phone number, and that's about it. So we can help them with that process. And sometimes just getting them on the phone with a support person will assuage those concerns that this is going to be a complicated process and there's a big upsell. None of that happens. It is always absolutely 100% free for anyone to receive a message that's sent to them through secure mail.
And yeah, I think, to that point, I've talked to clinics who said, if someone's not receiving information or sending information securely, what other risks are they imposing on my patients, right? If I refer them over there, are they sterilizing things properly? Are they following other protocols if they're not following privacy compliance rules? That brings us way over our time today. So thanks for tuning in. We do have one more quick poll question. If you've got a moment to fill it out, I'm just going to launch it. Just let us know if you're trying to improve clinic performance in any way. Looks like we're in, and everybody is. So that's great. Probably why you're here. Thank you so much for tuning in today, Mark. Thanks for your time and insights as always, and we'll see you next time.
Thanks, everybody. Bye-bye.